Hello, welcome. We're going to talk about some of the signs and symptoms that patients come down with after being infected by the SARS CoV 2 virus and develop the COVID 19 syndrome. I'm David Mendonça. I'm here with Anthony Saw. So, we know that fever is probably one of the strongest criteria that we know of. If you have a high fever, it's highly suspect. Then we want to find out additional symptoms after being infected. What do you think, Tony?
Additional symptoms from the ones we have listed: cough, shortness of breath, uh, chills, muscle pain, sore throat. The big one is that differentiates from a lot of other ones that I've been educated on was the loss of taste or smell. That's the main one that kind of like is the classic one, but it's kind of hard to say because a lot of these are disguised as maybe a common cold, a flu, but a respiratory uh, infection. But yeah, those are the classic ones right here.
Yeah, I agree. I think we learned a little bit because this is a novel virus. The symptoms are very similar to a viral infection. However, yeah, that bottom point there about that loss of taste or smell seems to have a high probability if you have that. I mean, we're learning every day. I think our clinical providers, we have additional questions and assessments that we do to kind of rule in or rule out, which means we're trying to figure out whether you possibly have or don't have this possible COVID 19 symptoms. Um, yeah, so it is kind of difficult for the layperson.
Yeah, I mean not to spread fear, but the one is fever. The classic one is 100.3, 103.4, but it can be a little bit lower. But not to spread fear, but just be aware. But it needs you should also have the other things, not just a fever alone. So don't think that every time you have a fever that you have COVID-19.
Okay, that's a good point to take. Sometimes what happens is that we just feel kind of lousy or have this malaise or general malaise feeling. We don't pay attention to the other symptoms, and we just feel hot. So what I mentioned in the beginning was, if you're starting to feel hot, you have a temperature of 100.4, it might be good to maybe they call their primary care provider, right, to get the additional symptoms checked on. And like I said, I think our clinical providers are learning about travel history, work history, contact history. They're using also their medical conditions, health problems, comorbidities, those kind of other factors when we're trying to decide what's the likelihood or possibility, because it's possible that everybody could have COVID 19. The probability, though, is very low. Now, the signs and symptoms, these are minimal signs and symptoms because we've seen other patients that have had mild, moderate, and then the severe symptoms where they're required to be hospitalized for weeks on days. And then, sadly, this illness does have its fatal side to it.
Yes. I think a good example would be we've transported here in Maui County numerous COVID patients, and not one of our personnel has been exposed.
Well, that's awesome. That's really good. I guess you guys are taking some good precautions. Going back to these signs and symptoms, one thing like I was talking about clinical providers, which isn't here. I mean, aren't the clinical providers knowing that maybe a pulse oximeter is useful also in diagnosing probably, exclusionary criteria if the pulse ox is on the lower side of normal.
Yes, thank you for bringing that up. That is they're calling this silent hypoxemia or hypoxia, where people don't even know that their oxygen. I think that might have been the reason why people were dying was they didn't even know that their oxygen level was so low. It was below a normal that your body would not sustain itself. So the oxygen was they didn't even feel that they were short of breath, but their oxygen level in their body was too low for their body to function.
All right, ultimately, you guys can definitely do more research. There's a lot of great sites to find information. I mean, there are multiple signs and symptoms, and as it gets into its more severe signs and symptoms, it's causing all kinds of other problems, causing uh, communication between the body and its cells. It's causing all kinds of issues like blood clots, problems in the lungs, causing them not to function at all, causing maybe even small little blood clots to cause stroke and all different other things. Isn't that kind of scary out there?
Yeah, that would be the confusion that people are getting with the blood clots not going. You're not getting oxygen to your brain, which is similar to the silent hypoxemia because there's no oxygen going to your brain, and if you don't have your brain functioning, then your body's not going to function.
All right, thank you, folks. You know, stay safe out there.
Aloha.